We're going to take you live now to Adelaide, where Health Minister Mark Butler is speaking.
I'm very confident that these measures will be able to be actioned by travellers from China, whether they are Chinese or Australian citizens who are currently working and living in China, will be able to access the sort of test that not only the Australian government is going to require before departure, but as I've said, governments from India, Malaysia, Japan, South Korea, the United States, England, France, Italy, Spain and others, I'm sure. So this is a modest measure. The requirement to have a test within 48 hours of departure, we think is a response that's modest and well calibrated to the lack of information we currently have about this fast evolving situation, and will be a relatively minor impost on people who are wanting to travel to Australia, and we'll welcome them here, whether they're coming to see friends or relatives, as tourists or as returning international students.
Can I ask you, a number of measures about COVID-19 are actually changing today, some funding arrangements, things like that. You said Australia's well positioned, but the wave that was meant to be over by now continues. The burden of long COVID continues to grow. The state and federal governments haven't really firmed up their position about who's going to pay for long COVID care and what form it'll take around the country. How are those discussions going? When do you hope to have some firm responses to these things bedded in?
Well, there are a range of questions in that one. Let me deal with the long COVID situation first of all. Obviously, there's a great deal of concern across the world about a range of phenomena that are being described as long COVID. That description refers to a range of different things. It may well be symptoms that endure for up to 3 months beyond the actual infection, but largely resolve after that. Long COVID can also come in the form of quite specific symptoms, for example, cardiological symptoms that require cardiological treatment. More worryingly or more difficult to diagnose is some of the multi-system disorders that people are experiencing for a considerable period of time after their infection, leading to things like fatigue, brain fog and a range of other symptoms. These are difficult to diagnose, difficult to treat. I'm very glad that the House of Reps Committee on Health decided this as their first inquiry. They're expected to report very early in the new year. And I think that will add a lot to the evidence that we have here of the prevalence and the particular nature of long COVID in Australia, because it will differ from other countries that had big spikes in COVID cases before widespread vaccination, for example. Ultimately, I think the treatment of long COVID will largely happen in the primary care system. And as you know, the primary care system through Medicare is largely funded by the Commonwealth. We're well set up to deal with this sort of range of symptoms. State governments have put in place in some areas long COVID clinics as extensions of their hospitals for people to go in and seek some initial advice and some initial treatment. But over the coming months, I think particularly as we get evidence in from this inquiry, which has been very active and received a lot of evidence from experts and patients and medical practitioners alike, I think we'll have much better information at hand as state governments and the Commonwealth to start to put in place some comprehensive measures to what is going to be a very significant burden on our community, certainly a burden on those individuals who are impacted by it, but also a burden on our health system.
Minister, if we could change tack, if that's okay, January 1, obviously with the PBS, some changes to that now. What kind of medical conditions will benefit from the PBS prescription savings from today?
Well, a vast range of conditions will benefit from the largest ever price cut in the history of the pharmaceutical benefits scheme, a history that extends to 75 years. Today, medicines for general patients will be up to 30% cheaper than they were yesterday.
That is where we leave. The Health Minister Mark Butler announcing COVID testing for all arrivals from China. That test must be taken within 48 hours of departure, and they must show evidence of a negative test when travelling to Australia. He's describing it as a minor impost to people wanting to travel to the country.